Governor Kathy Hochul tweeted out a photo of the laptop on top of a stack of books that she's using today as she works from the governor's mansion. She's in COVID isolation after reporting having tested positive yesterday. One of the things she did today was release this new information showing a steady rise in cases statewide, including her own. The COVID rate right now is 7.2%, or 47.7 cases out of every 100,000 people tested. What do those numbers mean? Well, compare them to a month ago when COVID numbers were about half of what they are, or even less. The rate was 3.7%, but the more reliable number, according to the CDC, was much lower than now. That number, 22.2 cases per 100,000.
It's not surprising given the constellation of things that happened just a couple weeks ago with Easter, Passover, school vacations, and travel all happening at the same time, right when the mask mandates, in particular for airline travel, were lifted.
An airway and ear, nose, and throat expert, Dr. Susanna Hills, specializes in conditions related to respiratory issues like COVID. She points out that the rising numbers don't include home COVID tests, which have become more available to people in the last few months. With those numbers not being reported, how reliable are the COVID rate statistics?
The trends, I think, can be very indicative. So if we're seeing an increase in case numbers like we're seeing now, that increase is certainly reflective of an overall increase across the city.
So the trends are reliable, she says. Across the city, recent numbers show 3,176 cases now compared to a month ago when the city saw a much lower 1,964 cases.
Things are getting busy. And these are difficult times, and a lot of people are getting infected, like people who have not had infection for over 2 years.
Dr. Waleed Javed directs infection control at Mount Sinai. He says that while the numbers in the city overall are rising, the increases aren't as high as last winter or early in the pandemic. So at his hospital,
it's not choking the system.
Still, he says, the trend higher is one that requires all of us to take action.
When I'm traveling or commuting, even if it's not required in certain areas, I would continue to wear my mask. I'll continue to do that until I see a number that trends downwards.
James Ford, Pix 11 News.